Welcome to the Senior Moment. This is Connie Clark with Home Helpers. And today in the studio with me I have Carrie Berglund, and she is with North Star Retirement Community here in Coeur d'Alene. Welcome, Carrie.
Thank you. Happy to be here.
Absolutely gorgeous. I think spring is coming, maybe.
I think so.
Maybe. We'll wait and see. Don't plant all your plants just yet. But what we thought we would do today is talk about independent living, assisted living, what the differences are between the two. And then I know I get a lot of phone calls, and I'm sure Carrie gets a lot of phone calls wanting to know, well, what do I do when I go into one of these things? How do I know what to ask, what to look for, what questions? It's this like
how to start the tour.
How to start the tour. What do I
Right.
do? So we thought we would go over some of the things you probably should ask when you tour either an independent or assisted living facility. Things you probably wouldn't think of just walking through, and a month, 2 months, 3 months later, you might think, oh my gosh, I wish I would have asked this sooner.
Absolutely.
So we're
and
gonna,
knowing where to start even.
Yeah.
Which one?
Exactly. So we thought we would have that discussion today. So Carrie, first off, tell me, what is the difference between an independent living and assisted living?
Independent living community would be for the folks that typically live on their own in their own home. They might decide, or their family might decide, the kids might decide, mom or dad or grandma or grandpa, maybe it's time that you actually get away from the yard work, you're not driving anymore, you need, maybe get some transportation to take you to doctor's appointments. They're still living independently, but just don't need the burdens of the household anymore, basically. They don't want to cook for themselves any longer. They're not eating properly because they are living at home. They might be isolated. Those would be a really good candidate for an independent living community.
So it's someone that, still might be driving, still wants to go,
Travel.
here, there, travel, do whatever. They just don't want to have to deal with the lawn, the snow, fixing the
Absolutely.
roof,
Yeah,
all that kind of stuff.
And like you said, you brought up a good point. Independent living, a lot of the residents drive. A lot of them are on cruises right now. They're taking trips. They're going to see grandkids. But again, they just don't, they want to live privately in their own apartment, but they don't necessarily want to live in a home, in their own home.
And it is an apartment.
It
it's
is a
not
private
just a room
apartment.
with a bed in it. It is an apartment.
And I'm glad you brought that up too, because a lot of when people are touring, they'll call them rooms, and they're not rooms. There are rooms in different types of communities. That'd be skilled nursing, something other than we're going to talk about. But retirement living, it should be apartments.
With
private
a kitchen
apartments.
or a kitchenette or something.
Absolutely.
So if you wanted to fix your own whatever, you could.
You want to bake, you want to, cook a turkey, you can. But you have the luxury to be within a community. So you walk out of your apartment into an enclosed community, so you've got the safety there. You're not walking out into the weather. You would have staff 24/7. So if you needed help with something, you can go to the dining room. You should be able to do activities, or you can stay as private as you would like and independent in your apartment.
So that's the independent. Now, what's the difference between that and assisted?
Assisted can still be independent. That's where it gets a little confusing.
Kind of iffy.
It is. The assisted could be that, let's say somebody moved into a retirement community, and let's say 5 or 10 years down the road, maybe they fall and break a hip, and they just aren't getting along like they used to. They can't get up like they used to. They can't bathe like they used to on their own. They just need a little bit more help. And the range of that can be a little bit of help to a lot of help. So somebody like that could actually go into an assisted living apartment, and it's still a private apartment, but you've got the comfort that you have staff coming in a licensed community overseen by a nurse, director of nursing, that would come in and help you with those specific needs. So it's very specific to the person's health condition.
Okay. And they can still come and go as they please and that sort of thing. It's just now there's people there that can help them with some of the things they might need help with. And when they're on the independent side, the facility where they're living cannot provide that service.
Correct.
And I say that very specifically because if you're living in an independent facility, you can bring an outside agency in to help you with those things.
Yeah, bathing, dressing, med reminders, things like that. Now, the independent community does still respond to e-calls, which are emergency calls. So typically in a retirement community, even if you're independent, when you move in, you would get a e-call pendant, and that way you have the security that if you are in your apartment and you do slip in the bathroom, or you just are not feeling quite right, maybe you're feeling like you could possibly be having a heart attack, you have the measure to push the e-call pendant and have the independent side support you and run up to the apartment, do an assessment, and then immediately call 911.
And we might as well get this out because we talked about it before the interview, but we might as well get this out right now because there has been things in the news recently about an incident that happened where someone was living in a combined community. And when I say that, I mean that one half was assisted and the other half was independent.
Right.
And a person on the independent side had a medical situation happen and they needed CPR, and the facility would not provide someone to do the CPR. And that's an important question when you move into a facility, an independent facility. Will the staff perform CPR on me if I so desire that?
Absolutely. And I would still check with every community, like you said.
Because each one's
check.
different.
Everyone's different, but typically the staff should be trained, be certified in CPR, first aid, and again, they would assess the situation immediately. We all know the steps. You do the assessment, you make sure it's safe, you call 911, you start CPR, because you want to start, obviously, get 911 there as quick as possible, but of course you want to begin CPR if that's what the...
So when you're going and looking at an independent living facility, that's one of the big questions you need to ask.
Definitely.
Is, if I do not have a do not resuscitate order, will the staff perform CPR on me if needed? And you really need to ask that question because there are facilities that won't.
Yeah, and unfortunately we all heard about it, like you said, in the news. So, and then there is the Good Samaritan law where, you're obviously trying to do the right thing. So...
But I thought we'd just get that out in the open now.
Absolutely.
Okay. So if someone is looking at an independent living facility, what are typically some of the questions you get from people when they walk into your facility and it's like, okay, I want to look around? What kind of questions do you get?
The first, you should always do a discovery process. You should always look at multiple communities. You need to think of the situation that your loved one or yourself is in. Talk to your physician. Am I a candidate for an independent retirement community? Should I go more to an assisted community? That's one of the first steps I would do. So before I even started to tour, I would almost back up and talk to your family physician, whoever is in charge of your loved one or yourself.
And get an opinion from them?
Yeah, absolutely. They know you probably better, except for your own family members. They know your history. They know if maybe you're just having a little setback. Let's say you're using crutches right now because you had surgery or something. But again, you live independently. So I would assess the situation for the needs of the person looking, and then go into the community and start touring. Tour 3 or 4 of them. Always have meals. They usually offer complimentary meals. Always come in at different times of the day to see what the environment is like, early in the morning, at lunchtime, later in the evening, to make sure it's the right fit, again, for either you or your loved one. So,
yeah, and surprise. See what's going on. And you bring up food. Food is a big thing.
Very important.
And one of the things I think you would probably want to know is if your loved one is diabetic or has specific dietary needs, can the kitchen accompany?
Absolutely. Yeah.
accommodate that.
You don't want to move into a community later to find out that they can't accommodate that or won't. That's a huge one. Do they offer the activities you're interested in? If you don't care about arts and crafts and bingo and that's all that's offered, it might not be the right fit. Socialization and nutrition are the two biggest things, obviously, for the seniors.
And I would think before you would go in to look at a facility, you would check them out on the Better Business Bureau.
Do that, go on the website, talk to residents. It's so important when you go into any community, regardless of who you're meeting with, the employees that are possibly touring you, stop and talk to a resident. Just stop and get open feedback, ask them if they like it, how long have they lived there. You could even ask them if there's anything that they would change about the community, you know. But
that's a good point.
it is. It's really good because the residents living in the communities are going to tell you the truth. So.
Oh, yeah. Oh, most definitely. And I had looked on care.com, and there are these kind of checklists and questionnaires all over the internet. So if you're getting ready to go and look at either one of these type of facilities, go do some research online, and you will find a gazillion checklists and things to help you. But one of the things it talks about is a sample admission contract. So I guess take a look at what you're going to sign.
And find out, yeah, and most communities will let you take that home and find out if is it month to month? Are you locked into a long-term lease? What if you move into a community and you don't really like it, regardless if it's assisted or independent? How easy is it going to be to move? Are you going to be locked into something even though you're not happy there? Are there fees for cancellations or actually getting out of your apartment? Those are all really important things to discuss.
And that's a good point, because there's a lot of people up here who winter south, and they don't want to keep a big home up in Idaho anymore, and so they may want to move into an independent living community for the summer and then leave and go down south in the winter.
That's very common.
Is it?
Very common.
And so you may want to see in that community, can you have that flexibility?
Right. If I'm only going to be here for 3 or 4 months, am I going to be penalized? So that's good to know. And even just finding out what's included. Are utilities included? Is cable and phone included? Do I pay for activities? Do I pay for outings? Because everybody's on a budget. And if you move in and then find out that there's charges,
all these fees are coming in,
right, that you weren't planning on, that's going to be disappointing for everybody, because everybody has a budget to live within. So,
and also different communities, they will either have 2 or 3 meals a day.
Correct.
And so you need to know that, especially if you're looking at your budget and your pricing. Am I going to have to find something for lunch every day now, or is that going to be part of the price?
Right. And on talking about money, the other important thing is you really need to know what your financial situation is. Are you private pay? What's considered private pay? You have retirement, you've sold your home, you've made money off your mortgage, you have enough to live for X many years. Do you have a long-term care policy that's going to cover part of your stay at a community? Are your funds going to exhaust after a few years? And you might have to look at Medicaid support. Those are really important questions to ask, because, again, you don't want to move into a community and your funds exhaust and it's private pay and now you've got to move again.
Now, does Medicaid cover independent living communities or just the assisted?
That's a question to ask each community.
Okay.
Because some communities will take Medicaid. Some communities actually take private pay and then they would grandfather you into Medicaid, and that really is community specific.
So that's another question you need to ask.
Very
because
important question.
A lot of people go, oh, okay, I can last for 10 years. Well, what if you've got 12, 15, 20 years left? What do you do at the end there? And that's probably when you're going to need the most care.
And cost of living increases. Typically, communities are 2 to 4% annually, that you would actually get a increase in your rent due to cost of living. Gas prices have gone up, food's gone up, transportation, trucking's gone up. So it's no different than us in our own homes. You know, you've got to expect utilities are going to change. So the communities do have to pass that along to the residents. So that's a good thing to ask too, is just what are the cost of living increases yearly?
All right, let me ask you another delicate question. Everybody is a human being and an adult in a community. What happens when you have men and women who become attracted to each other that are living independently? I know there's a lot of children that really get a little animated or involved in their parents' lives. And what happens then? I mean, what are the policies of communities for things like that?
When you're living independently, you really are living independently. If you strike up a conversation with the resident and you hit it off and you start dating and you want to go travel and you have a companion, that's wonderful. I mean, the only time it would become an issue would be if it's not warranted on one side. So possibly a resident is approaching another resident that is not comfortable with it. Then that resident would definitely talk to the administrator of the community and, just say that this is happening, I'm not comfortable with it, and then it would be addressed appropriately.
So the person wouldn't have to worry about no longer having a private life.
Exactly.
In these communities. Okay. Another thing I want to just kind of throw out there because those things happen.
They do.
Yes,
and
they do.
On that same note, find out if it's your mom or dad that lives in the community, can you come and stay? Can you come in any time of the day and visit? Can you bring the grandkids? Are they pet friendly? All these things are important that you shouldn't just assume is allowed in a community. Can I come in at 10 o'clock at night and visit my mom? Is that allowed? Is there kind of certain hours that the community keeps the doors open? Is there certain times the door is locked and they don't allow visitors? Find those questions out.
And that's a good point because the resident may be a night owl.
Exactly.
And likes to go out till 2, 3, 4 o'clock in the morning. Find out if they can get back in.
Right.
I guess. Because I would assume with security, there's usually a main entrance for the residents.
And even communities typically would lock the doors. They're not what's called a lockdown community. People can come and go as they please, as we spoke about. But typically later in the evenings, the communities that we're familiar with do lock the doors because later in the evening, residents have the keys, family members have the keys to the front door. So it's more to keep out, people that shouldn't be there. So the doors are locked, but there should typically be a buzzard. So if you are out late and you forgot your keys, you just hit the buzzard. There's somebody staffed 24/7. They come and let you in.
But you should really ask that question.
You should definitely ask that question.
Because
you shouldn't assume, like you said,
right.
If you're a night owl and you go out to a show or a play or something, you get back really late, you want to make sure that you can get into your apartment.
Absolutely. Well, we're going to take a break, and then I want to come back and talk about some things on the assisted side.
Sounds good.
That you should probably look for. So we will be right back. That was one of my first, oh my gosh, kind of moments. I walked through a facility, and there was a man and woman necking on the couch. I was like,
well, and we have residents that strike up little relationships. We don't know what they do behind their apartment doors. It does become an issue, though, if one of them, again, is not
right,
is feeling not threatened, but a little bit like, I am not interested in this, and I feel like
There was, there's a community down in Florida near where I'm trying to think of the name of it, and I can't off the top of my head, but it was a independent living community, and this girl was a filmmaker, so she started doing a documentary, and she did it over a 2-year period. And it ended up being one of the shorts for the Academy Awards. And it didn't win, but it was talking about all the relationships and the things going on, in an independent living community. And it was like, oh my gosh, Yes, that's true.
It is like a college dorm. I mean, a lot of people. And one thing you brought up an awesome point. One thing we should talk about is what is the male to female ratio in the community.
Ah,
If you are a single man moving in and you want to socialize with men, how many men live there?
oh, okay.
Or vice versa. If you're a female, I mean, typically there's more female.
Right.
But if you're a female moving in and it's mostly a male population, do you really want to move in there?
Good point.
So that's
point.
a good one to talk
Okay.
to. And how many couples are there? If
Okay.
it's a couple moving in, are there other couples to socialize with?
Okay.
So that's a really good point.
All right. You ready?
Yep.
And we're back. Welcome back to the senior moment. I have Carrie
Berglund.
I love. Okay, I just went totally blank, and I know her.
It's the weekend.
From North Star, and we've been talking about the differences between assisted living and independent living, and also talking about some of the things you should look for when you move into one of these type facilities. And we had started talking about relationships of residents, and something you brought up during the break was, as an example, if you're a male and you're moving into a facility and you like to have male companionship, buddies, is there a lot of males in the community? Because typically there are more senior females
absolutely,
than males. And if you're moving into a facility and there's only a couple males in there, you may not like that.
You might not be compatible with them. Again, you might like to play bridge and they don't like to play bridge. You want to definitely find out what the ratio is of men and women. And then if you're a couple moving in, are there other couples that you would enjoy socializing with? And if it's all, single residents and you're a couple, you might want to look for a community that has more couples, just so you're more compatible.
So look at the demographics
Absolutely.
of who's living there. That's a very good point. And these are all things, you don't really think of it when you're walking through, because your sensory is like on overload, looking at all these new things that you've not seen before. And then, days later, weeks later, months later, you go, oh gosh, I wish I would have asked that question.
Or I wish I would have known I couldn't have a powered scooter in the community. And again, usually if unfortunately, a lot of times when it's the kids helping mom or dad move in, it could be because they've just lost a spouse, they've just lost their dad, they just lost their mom. So, everything is just chaotic. They're trying to get the surviving spouse settled and moved and get socialization and nutrition, so you aren't thinking of all these questions. Now, if you are a senior and your house is on the market right now, chances are you've done all your due diligence and you've been preparing for this. You're in good health, and this is something that you and your wife have talked about for a long time. So it's not uncommon to have folks that have looked at communities for 2 to 3 years. And they're just planning for the future, which is great. But unfortunately, a lot of times it happens more on a need, an emergency.
A crisis basis.
Crisis, absolutely.
And you had mentioned something earlier about pets. Do all communities allow pets?
No, they don't. And that's if mom has a cute little doggy she's had for 14 years, that could be detrimental to her to have to get rid of it. So you want to find out if they're pet friendly. Is there pet fees? Do the pet fees expire after a certain amount of time? Damage deposits? It's really like, renting an apartment. So you want to find out all the rules of the apartment community.
And if you have a pet, do they have a place, especially if it's a dog, do they have a place where you can walk the dog that you can get to easily?
Right.
Especially if you look at our winters here, is there a place you can take the dog safely for you?
Or does the community offer those services for you in the winter? Possibly if you just don't really feel like getting outside in the winter. So you do need to take all that into consideration. You also need to consider, is the pet going to become more burdensome for you while you're in the community, and you're not going to feel like you can come and go as you used to, because now it doesn't have a yard to go sit out in while you go to the grocery store. Now it's sitting in the apartment. I mean, you really need to think about it on the other side too.
And I've seen some communities that have community pets.
Mm-hmm.
So
that's really nice.
So if you may not want to have the responsibility for a dog or a cat. I've seen communities where they have roaming pets,
Uh-huh.
you know.
Yeah.
So you may want to ask that question too.
Especially if you're allergic.
Ah, good
There's
point.
another question. There's the other side of it. If you're allergic to pets, you might not want to go to a community that allows pets.
Especially if it's a cat and there's cats
Right.
wandering, because I have
Yeah.
seen that.
Yeah.
Now, I see something that asked about a resident bill of rights. What kind of thing would be on something like that?
More of the contract.
Okay.
Is that what you're talking about? When
Well, and what I'm probably thinking is what the residents' responsibilities are and what the facility's responsibilities are. There's a lot of facilities that have a bill of rights that says
that
you
would
have
be
the right to
outlined-
expect.
yes, absolutely, in the contract. And then assisted living, there's actually posted for residents in the assisted living community. It's a little bit different, and it's actually it has to be posted out in the common areas.
So
what the rights are for the residents.
Take a look at that. And also it says on what I'm looking at having to do with an assisted living facility, those facilities are inspected by the state.
Absolutely, they're licensed.
How often does the state come in and inspect a facility?
Typically yearly they come in, and it's usually unplanned, so you never know, which is good. I mean, you know, the communities don't know when they're going to stop in. So
And you can go online for the state of Idaho under health and welfare and see the results of those surveys.
yes,
So if you're looking at an assisted living facility and want to know, well, how do they do in their inspections, you can get a copy
information.
of how they did. You can, and also you should probably get a copy of what their events and activities are
Yes,
to take a look and see, like you said, if you don't like to play bingo and play bridge and that's the only thing they have,
it
and
might
you,
not be the right fit.
and you really like to go down to the casino and they do that once a month and that's not enough for you, you know, you really do need to see if the activities are going to be what you want to do. Now it says on here to take a look at the weekly menu of meals and snacks. Now I know each facility is different. Some of them have a set menu. This is what you get. And some of them actually you choose off a menu.
And that's
what you
very
want.
important. And like you said, it goes back to the dietary needs to make sure that they can accommodate the needs when you move in. And like you said, if it's a set menu and you don't really care for anything on the menu that whole week, you know, you've got to make other arrangements, or you might want to look at a different community, or definitely be able to know that you can talk to the nutritionist or the chef or who's ever preparing the meals and see if that can be altered or modified prior to moving in, so you know up front.
Now, when we talk about cost, the cost for independent is quite different than the cost for assisted.
Correct. The differences are when you're an independent, you have rent, and then what rent includes is going to be different for each community. Some communities it could be all the activities, all the transportation, meals, utilities. It could go on and on. Housekeeping. So you want to check that. When you go over to an assisted living community, you're going to pay rent, but then there's a care plan fee on top of that. So you still have your rent, you'd still have whatever's included in the rent, but in the assisted living side, you have the director of nursing that actually has to perform an assessment on you prior to moving in. There's documents that have to be completed. You have to send over it's called a HCP. It's a healthcare practitioner statement to their attending physician prior to moving in. Because again, are there underlying health conditions that the community doesn't know about and potentially the resident doesn't talk about during the assessment with the nurse?
Good point.
They might just not have the ability to remember all the health conditions that they have, or all the meds that they're on, or underlying things that if they have a little dementia, Alzheimer's, of course, they're not going to be able to do a accurate assessment. So when the nurse does the assessment prior to somebody moving into assisted, it's always good to either have a family member or somebody else there representing them. Once that's done, the care plan cost is then set up. So that's typically how the communities do it. There are times when you actually cannot accept somebody that is looking to move into an assisted living community because it's beyond the scope of the licensing. So it could be something as a Hoyer lift, for example. They need help with a Hoyer lift to be transported. Not all communities are set up for those. So there's a lot of little fine details, too, that when it gets down to your specific health needs, that it might or might not be the right fit. And that goes back to the licensing.
Well, and when you mentioned about the doctor, does a doctor have to write an order for someone to be in an assisted living facility?
No, they would have to receive the HCP back that says your client, John Doe, is thinking about moving into our licensed assisted living community. The director of nursing will do the assessment, but until, the assessment would happen along the same time that the doctor would be completing the HCP, the healthcare
So you have to have that signed by the doctor.
You have to have that as well, right.
And what that is it's not saying, yes, you have to live here, but he's just saying these are your medical conditions and I'm signing off on it.
Right.
And so then they write a care plan of what is going to be done to be cared for you on the assisted side.
The director of nursing would do that, right?
Okay.
But then they would also use the information from the assessment they do and the doctor's documentation that's completed. So again, if the doctor says they are beyond an assisted living community, they should be in a skilled nursing home, or why are they going to an assisted living community? They should be on the independent side. So there's all the little factors, but it's not common to not be able to accept somebody. They're just beyond the licensure that that a community has in assisted.
And so when you go in and this assessment is done, at that point you find out this is what the cost is going to be for someone in an assisted living. Now, that might change depending on the person's abilities.
Yeah, they could get better. They could have they might have just had surgery, so they're going to need a little extra help at first, and then in a couple months they actually don't need the assistance anymore as far as bathing or toileting. So then that care plan should be reviewed again, and the costs could go down. As somebody ages in place, the cost could go up because maybe they're requiring 10 visits a day, and meds have changed, and toileting, bathing, cognitive issues, everything has changed. So the care plans are not set in stone. They change. They're going to modify.
And how often do they modify those?
It is basically based on the person and, again, their condition, but they should be reviewed every few months. See what's going on. Make sure, if you're a family member and your mom or dad's living in an assisted living and you think, I think they're not requiring as much as they used to, ask to talk to the director of nursing. That's the other thing. You should always be able to have that open door policy with the administrator, the director of nursing, the staff, as far as how do you think mom's doing? Are they getting down to meals? Are they eating? So.
Now, when you talk about are they getting down to meals and are they eating, I know on the assisted side they would pay attention to that sort of thing. Mm-hmm. Do they do the same observations and interaction with the family on the independent side?
The independent side, it's that fine line again, but most communities do. Most communities are going to wonder why, again, John Doe has not been down to the meals, or they have a check system daily that they check on the residents at least once a day. So that's the other benefit of going into a community, is that there is a check and balance system of the residents need to check in by such and such time daily, and if they don't, then the community has staff that actually go and make sure that somebody has actually seen them, they've been to breakfast, or literally go up and check the apartment.
So you should really check to see if the independent living facility does that, or if they leave it totally independent, no, I haven't seen them for a week. I don't know where they are, you know.
Right. And that
That
would be
sort of
more
thing.
like a retirement senior living apartment would be the one that it's more hands off. That basically they're living in a community with all seniors, but there's really, the staff leaves at 5 o'clock in the afternoon and they're gone. And the residents are really on their own. So that would be more of like a senior living 55 plus community.
And when you're looking at a community, find out if there's extra fees associated with doing laundry. Some of the independent places offer laundry, some of them don't. Some of them you have a coin laundry, so to speak, in the facility.
Some could be complimentary. So it's all good. Again, it's all budget related. So you need to check on that.
And if there's any special move-in fees.
And what specials are going on? Is there a special that month that you can take advantage of? So the other things are, what do they help you with in the apartment? Let's say your refrigerator breaks. Who fixes it? Do you pay for something to get fixed? Is it part of the community? Does the community pay for it? So check on maintenance fees, moving. How do you move in your items? Do you bring your own items? Are they furnished? Are they unfurnished apartments? So typically they're going to be unfurnished, but ask, how much can I bring in? Is there a limit to what I hang on the walls? Is there a limit to things I put outside? You really want to find that information out.
Okay, very good point. Well, we're going to take another break, but we're going to continue this conversation because this is all really good information. And you may think, yeah, I don't need to know this, but next month you might.
Absolutely.
So we will be right back.
Am I losing it?
Yeah, every now and then when you're...
There we go.
Better. Okay.
And I need to not lean back. So,
Okay.
what else are we talking about?
Okay. All right. How about we start talking about the staff that's at on the assisted side. Let's see. You're doing real good jumping in with stuff that I didn't even think about. Okay. Yeah, let's go with the assisted. And we keep bouncing back though.
Yeah, but it's all good.
Okay. You ready?
Yep.
Final one. And we're back. Welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers, and I have Carrie Berglund with me with North Star Retirement Communities. And we've been talking about independent living facilities, assisted living facilities, how they're different, how they're the same, what sort of things you should look for when you're touring them, before you move in, what kind of questions to ask, that sort of thing. And we've been kind of bouncing back and forth between the two because every time we start talking about something on one side, it brings up a question on the other side. So I hope we're not confusing you too much. But on the assisted side, where you have people that are taking care of your activities of daily living, I would think one of the questions you should ask is what type of, I don't want to say what type of people do you have working there, but what are their titles? What are their qualifications of the staff, I would think?
Are they CNAs? Are they, what's their training? A really important point is background checks. Ask the community if they do background checks on the employees.
And how often?
How often have they done a background check? You can ask what the qualifications are. If you have a director of nursing, then typically they don't have to necessarily be a nurse or nurse's aide. There can be other positions that are allowed under the license. But do ask those questions as far as the background checks, because you do want to know who is taking care of your mom or dad.
Absolutely. And one of the things that I have run into in my business is you can do a background check on someone today, and it could come out clean. Next week they do something they really shouldn't have done, and you don't
This
know
weekend.
that. This weekend they could have, and you don't know that because the background check was done last week. So a question would be was how often do you update that?
Absolutely.
Do you look
again? Do ask that question and find out.
And I hear it a lot on our side is what's the ratio of staff to resident?
And hours of the day. How many are here during the night shift on the assisted living? And then back to independent again, because we're bouncing back and forth. Is there staff supporting the independent community as well, 24/7?
Especially what we were talking about with if there's a medical emergency in the middle of the night, if there's no one on the independent side that can help them,
right?
Then that's an issue.
And the other, since we are talking about assisted and independent retirement, does the community offer just one or the other, or do they offer both? So that's another good question to ask, because mom might go in today independent living, and again, a couple years down the road, health declines a little bit. Can she then move to the assisted side in a community? So you want to find that out. What all does the community offer?
And that's an important point, and I'm glad you brought that up, because they've already become familiar with the surroundings. They've become familiar with the staff.
They have friends.
They have friends that they like to sit and eat with and that sort of thing. And if they have to go somewhere else, that's a whole nother traumatic event for them
in their life. Right.
Whereas if it's in the same community, they can still see their same friends. They can still see the same staff. It might be a different apartment because it's in a different side, but
it's an age in place, which is nice.
Exactly.
If
They're
they can
still
just age in place
in the same one. And about overnight staff. I mean, we hear it where there's places where there's maybe one or two persons on staff and they've got 40, 50, 60 residents to take care of. Well, if there happens to be a situation with one person that requires both those staff members, what happens to the rest of the people?
To the other residents. Absolutely.
So you need to ask that question. And is the turnover rate of the staff high? Or do you have people that have been there forever?
Yeah.
That tells you how well the staff is being treated. And that directly results in how they're treating your loved one.
Absolutely. Yeah, you do. You need to check on all that. And it seems overwhelming, but like you said, there's so many good resources on the web that you can just print out checklists. A lot of communities will even give you checklists. Go shop some communities, find out if they do XYZ, follow this little list. You should ask for that if a community offers that. And if not, like you said, Connie, just go online and get the documents, print them out. It just makes you a better educated
consumer, absolutely.
Which is important, very important. So
because you're putting your loved one in their care.
Or
yourself.
Yourself. You've decided to move there. Age is another thing. Find out what the minimum age is, because it can be different at all communities. So find out the age.
Of the residents?
Yes.
Okay.
If you're a very active, thriving senior and you're just a go-getter and you drive and you walk and you go to exercise classes and you do all this stuff and you walk into a community and you just feel like the level is a little bit higher, it's something that you want to look at. But on the other hand, you don't want to, the same thing could happen to you. Like we say, tomorrow could be a whole different day and your circumstance can change drastically. Next thing you know, you're having to use a walker or a wheelchair, and that's very common in an independent retirement community. Just because you're using a walker wheelchair doesn't mean you're not independent. So
very true. And we were talking about the staff and all of that. And one of the things on the assisted side is that they can handle the medications for you. So if you have someone who is taking a lot or just a few medications and getting them all confused, that is something that in an assisted living, they can handle that. That being said, who is the person doing that?
Right.
and what qualifications does that person
Have
have.
they had training on how to give meds? Do they know if one's going to conflict with another one? Yeah, it's all very important.
And you know, is that person, again, is that person trained? Are there background checks being done on that person? You know, because there's a lot of medications out there that people are looking for. You know, so you want to make sure.
In this day and age, unfortunately, yeah.
And also, on the assisted side, again, do they allow the pets? Because I would imagine in some instances they might allow them on the independent, but it may be more
They could
restricted.
be a fall risk. Yeah, it could pose a huge fall risk if a cat or a dog gets under a resident's feet and they're not steady anyway, and next thing you know, I mean, that you really do have to take a look at all that. And I know it's hard to not allow a pet. That's a child to most of us. But you do have to look out for the safety and well-being and health of the resident. So,
One of the things that I saw in this questionnaire said, are residents required to have renter's insurance?
that's a good question. A lot of communities don't require it, but they recommend it because, again, if something happens, then so.
Yeah, and that's something I would not have even, thought about. Now, this one says something about, does the facility have an adult day program? Now, do some facilities have sections of them where persons that need special care can be cared for?
That sounds more like skilled nursing, but because in assisted living, the plan is going to be laid out for them.
Okay.
Yeah, so that sounds like it might be a little bit geared more towards a skilled nursing facility.
And let me ask a question. If you need respite, if you're caring for your mom and, she doesn't need skilled and she's still cognitive okay, but she needs someone to help her bathe and do all of those things, do assisted living facilities offer respite? So if you want to go away for a week, 2 weeks, whatever, mom can come stay there?
Most of them do, and that's another great question because that is a growing trend, the respite stays, because a lot of the parents are living with the kids, and like you said, maybe I'm going to take a trip and I can't care for mom for 2 weeks. I need to know either to call an in-home agency to come and care for mom, and if the circumstances is such that that's just not enough, then they can be, again, in a licensed assisted living just temporarily for the respite stay.
Now, when someone does that, again, when we were talking about signing a contract, I mean, if the person comes in there and they're there for a couple of days and they really don't like it, can they leave? Or when you bring in your mom, are you saying absolutely she's going to be here 2 weeks whether she likes it or not? I would imagine that would be a question you would need to ask too.
Absolutely. And typically you are going to you should be signing a contract just like if mom was going to be there permanently. There should still be an assessment completed. You should still have the healthcare practitioner statement completed. It's really no different. Just because they're there for a short term doesn't mean their care should be any less than a permanent resident. So,
because that would be really scary is if your daughter's taking care of you and she's going to go on a cruise for 2 weeks and, you've gone and toured this place and, yeah, it looks okay. And you get in there and daughter's gone and you're there for 2 days and you're going, you know what? I really hate it here. But I
Mom's
can't.
calling the daughter on the trip.
Yeah.
I want to get out of here.
But you can't leave because
Right.
you've signed a 2-week contract.
Yeah.
So that would be something really important to look at.
Yeah. And definitely refer to the physician too before you go out of town. Say, hey, I'm looking at a respite stay. Do you have any recommendations on communities? Have you heard or talked to the local hospital? Talk to Kootenai Medical. Talk to a social worker. I'm looking at a respite stay for mom. Do you have any recommendations? Because they deal with it daily as they're discharging patients at the hospital where they might just need a short-term stay to recover, to get back home later. So
Now you mentioned that, and we hadn't even brought that up, in that if someone is in the hospital for whatever, we always think of, at least I do, that they're in the hospital and they're being discharged from the hospital, but they're not ready to go home because they still have some medical issues. So they would go to rehab and skilled nursing. But what you were saying is it may not be as serious going into rehab in skilled nursing. It might just need assisted living for a little while.
A little respite stay. It's really common. Couple weeks, 2 weeks, common. Because again, they're just not quite at the level of going to a skilled nursing rehab facility. They just need a little bit of oversight, somebody making sure they're getting meals, their balance might not be, they're a little bit of a fall risk, and so the extra security that they're just temporarily in a assisted living respite apartment would just be the perfect fit for them.
Well, interesting. I hadn't even thought about that until you brought that up. So if someone wants more information on taking tours, what to look for, what to ask, what to watch out for, how would someone get in contact with you to ask you those questions?
I am at North Star Retirement Community, and my number is 208-765-5505. And again, it's Carrie Berglund. And we are located right on Celtice Way next to Holiday Inn Express, and we back up to Riverstone, so conveniently located in Coeur d'Alene. So be happy to answer questions. And again, it really is to get the right fit for your loved one or yourself.
And I know we've talked in the past, and that someone might come in, look at your facility, and after you're talking to them, you may say, this would not be appropriate for you.
Mom might have dementia, might be somebody that tries to exit seek, and if you're not a locked community, it's not the best fit for the loved one. It really isn't.
And you would let them know that.
Absolutely.
So don't be afraid, and that's another point. Don't be afraid to go somewhere and ask questions, because if you feel like they're trying to sell you something versus trying to help you find the right place, you may not be in the right community.
Yeah, and don't be afraid to ask them for other like communities who typically would shop. If I'm shopping with you looking for mom or dad or myself, what would be some other comparable communities I would look at? And they should volunteer that information to you. Absolutely.
So thank you, Carrie, for coming on and talking about this, because it's not an easy thing to do. And it's usually a struggle to get your parents even to look at a community to move into, either assisted or independent. And you've already gone through that battle with them, and now you're trying to do a tour, and you really want to find out as much information as you can to make sure they're happy, but you don't know what to ask.
Yep.
So
always take the meal. Ask if they even do a guest stay. We didn't talk on that. I know we're out of time, but a lot of times you can do a complimentary guest stay in one of the guest suites that's fully furnished. So you can just bring your personal items and enjoy some activities for a couple days, and there's no charge for that. So try it before you buy it.
And see what it's like.
Absolutely.
Good point. Ask if they let you do that.
Yeah.
Good point. Well, thank you, Carrie, for coming on with me.
Thank you, Connie. Enjoy the weekend.
Oh, absolutely. And the sun. Yay. And you all, I hope you have a wonderful rest of your weekend. Good day.